we do what's known as a specific adjustment. Yes, you may have heard the term adjustment before. Yes, a lot of chiropractors do adjust, but our understanding, which comes back from Dr. Palmer, is the adjustment can only be done where there's a subluxation. And we already said the subluxation can only exist here. So that's where the adjustment is. We do not do any twisting or popping of the head or neck. It's actually a table that's designed just to unlock the upper cervical area. We get it in the best position. It's a specific contact and adjustment and setment. And then what we do, which is extremely important, is after that adjustment, which sets the vertebra in the correct position, we will have the patient rest, which seats it. And that is huge. That is so important. We don't want to do that over and over and over again. The less we need to adjust the person, the more they can hold that specific adjustment, the quickest possible way to health and healing they're going to have. By far, we see patients who can hold a first adjustment for a month, 2 months, 3 months, 4 months, maybe longer. They're just doing so much better than a patient who in 4 months needed 4 adjustments, 5 adjustments, 6 adjustments. Now, it doesn't mean they're not getting better. It's just if it's going in the right position, then it's going out, and then it's going back in and going out. There's a little bit of that up and down kind of in there. They're still improving, but there's no question. You get this wide open and free, that's what you want for as long as possible. That's the best way to healing if there is. So we talk about that here. The resting room to seated, the holding power, which allows for the best way back to health. Now, basically, allowing the doctor within. We talked about innate intelligence, and I'll say it again. We always give credit to innate. That's really what runs everything. That runs your body. And so when people get well, that's what does it. It's innate, it's on the job. Let the healing begin. It does take time. We teach that to everybody, all patients. It takes time. Some people have wonderful starts, okay? We've had an adjustment, a first adjustment, and people notice big changes, and that's wonderful. And I always hope for that, and I strive for that. But the reality is that's going to be 2 or 3 out of 10. The 7 or 8 out of 10 are going to be the ones who notice little changes, and little by little, but they're improving and getting better. And that's what this is about, making sure there's improvement there. So see.